to the MoneyRx for CRNAs podcast, where you go behind the scenes with host Brett Fellows, CFP, as he explores the unique opportunities and challenges facing Certified Registered Nurse Anesthetist along the path to financial independence. In each episode, Brett shares expert insights and actionable advice, equipping you with the tools you need to take control of your financial destiny and retire on your terms. And now, here's your host, Brett Fellows.
Welcome to the MoneyRx for CRNAs podcast. Today, I have the pleasure of sitting down with a truly remarkable guest, Tangy Kincaid. Tangy is a CRNA with a deep passion for anesthesia and mental health, and she's made it her mission to help patients in a way that truly changes lives. After earning her master's degree in nursing from Murray State University in 2008, Tangy began working at a Level 2 trauma center in Texas, and later pursued independent contracting throughout the Dallas-Fort Worth Metroplex. It was during her time working at a chronic pain clinic that Tangy discovered her true calling in ketamine therapy, a groundbreaking treatment for patients battling mental health disorders like depression, anxiety, and PTSD. In our conversation, Tangy explains how ketamine therapy helps patients who have been resistant to traditional therapies, offering them a new path to healing by altering brain receptors and enhancing the effectiveness of overall psychotherapy. For Tangy, the most rewarding part of her work is seeing her patients transform from states of deep anxiety, depression, or trauma to a place of well-being and hope. Tangy also takes us through her incredible journey from the operating room to independent practice, where she now runs not one but two businesses, KT Anesthesia and Zenfusions. We dive into the challenges she's faced as a business owner, from navigating the stigma around ketamine therapy to the complexities of managing a growing practice. Tangy's insight into the importance of building a strong support team, including a skilled accountant and attorney, is invaluable for any entrepreneur. And of course, we touch on financial planning, an area where Tangy's interest has grown as her income has increased. We discuss the different strategies for funding retirement, with a focus on the specific needs of business owners like Tangy who are looking to retire on their own terms. Whether you're a curious healthcare professional, a seasoned CRNA, or simply looking to make a meaningful impact while navigating the challenges of entrepreneurship, you're sure to find Tangy's story and the wisdom she shares with us today inspiring. And with that, I hope you enjoy this episode of MoneyRx for CRNAs with Tangy Kincaid. Welcome, Tangy Kincaid, to the MoneyRx for CRNAs podcast.
Hi, Brett. How are you?
I'm great, thank you. And I'm excited to have you here tonight. And so thank you for your time. Not only are you a CRNA, but you are also an independent business owner. So we like those two that match. And I think what's unique about you and why I was excited to have you on is even as a business owner and a CRNA, you actually have your own niche, if you will. And that is ketamine therapy, which I know is a very not new drug or topic per se, but how you use it, I think, is very kind of cutting edge. And I'm just excited to learn about it and learn about your business. Thank you for coming.
Absolutely. I'm excited to be here.
So your company, you are the founder and CEO of Zenfusions in Dallas, Texas. Tell me, I guess, let's go back to the beginning, Tangy. How did you know that you wanted to first become perhaps a nurse or a doctor? What was the journey that you led that got you into this field to begin with?
I've always wanted to be a nurse and be in the healthcare field, so that part was easy. But once I was in nursing school, I really didn't know what I wanted to do or which field I wanted to practice in. But doing my operating room rotation, I was in the operating room and there was a CRNA who was at the head of the table. And the particular procedure was called a carotid endarterectomy. So that's where patient has plaque in their carotid artery in their neck. And the physician goes in and he cleans it out.
Okay.
And When they opened up the artery and I saw all that pulsating, I was just hooked. I just absolutely love it. So
Yeah.
I went to the floor for a little while, then I went to the operating room, and then I went back to get my master's degree in anesthesia.
Wow, that's great. And when you got your master's degree, have you always been independent, or did you work for a hospital for a long time? How did that path come across?
I did. So when I graduated in 2008,
Okay.
I came to Texas and I started working in the hospital at a level 2 trauma center and
Hmm.
worked in the operating room doing different kinds of cases, and I absolutely loved it. But then I got the bug for doing independent practice probably in 2017. And I just saw a different path where I could be my own boss, set my own hours, and just have a little bit more independence. So that's what I decided to
Yeah.
do.
Yeah. So that's neat. Can you tell me about that? How did you first learn about the independent channel? And I guess what specifically about it that really said that's more my speed? That's more what I want to do.
At first, it was scary because you're
Sure.
a W-2 employee, so you have your benefits and your
Yeah.
insurance, all those things. But I talked to a couple of independent practitioners who were still W-2, but they were also doing 1099 on the
Yep.
side. And they said, Tangy, these are things that you need to do. Will help with your retirement and grow your practice and grow you as a CRNA because you're more independent. You can do just different things you can in the hospital. So
Hmm.
I thought about it a little bit more, did some more research, and I was like, this is what I need to do.
Okay. And so what year was that? What year did you go off on your own?
2017, I went part-time. So
Okay.
I said I was
So
still
good. You were gradual into it.
graduate.
Very nice. Didn't
I
sink all
started
your ships.
in 2017, I went independent, like part-time. And then in 2019, I went completely independent, where I opened up KT Anesthesia and started doing anesthesia for a chronic pain management company.
Okay. And how did you, even when you started part-time, how were you finding jobs? Did you use some type of job board or app, or how did that work? Were you in Texas then too? Forgive me.
Yes, still in Texas.
Okay.
And the job board that CRNAs use and MD anesthesiologists use as well. And so I went
Mhm.
on there and just called different people, did on different job interviews just to see which one would be a good fit for me.
Okay.
And this one.
And then so gradually, let's say then maybe perhaps 2018 would be your first full year as an independent CRNA. How did that year go? Was that better than, let's start with the monetary side. Was it your best year ever in terms of billable hours, that sort of thing? Or did you make less than you did as a W-2?
The first year, I think I made less.
Mm-hmm.
1099 that I did as W-2, but my accountant talked me off the ledge and he said, it's going to be okay. This was,
Yep.
kind of, just keep at it. And so
Yep.
then the next year I saw a bigger profit and I was like, okay, this is going to be good for me.
And did you necessarily work more that next year, or did the jobs that you chose or had the ability to choose, they paid more? How did you make more than ensuing year than the first year?
I worked more hours and I was also making more per hour. So
Yeah,
that made a big
great.
difference.
Very good. And how did 2018, 2019, mentally and being able to control your own time and balance your life, for whatever the word balance means? I know it's different things to different people, but how did that work out as the way you wanted?
Absolutely. I was working 12 and 16-hour shifts in the hospital. And with these jobs, I was able to get off at 3 o'clock. I could come home. I could do the things that I really love to do, which are work out, cook dinner for my family, spend some time with my husband. So that balance for me was what I really needed.
And just so I understand, did you start as a sole proprietor, and are you now an LLC with an S corp election or anything like that? How are you organized, let's say?
Initially, I was going to do sole proprietor, but my accountant said I needed to do LLC. So I
Great.
started doing LLC.
Great, great. And what have you learned over, let's say, these last 6 years being a business owner for yourself? What part of the business side do you really like or not like at all?
Let's see.
Do you like to do the books?
I don't like to do the
Yeah,
books.
that's usually everybody's first. I don't like doing the books.
Yeah, I don't like doing the books, but luckily I have a great accountant who works with me. She does that. I guess the thing that I love the most is the independence and
Yeah.
the group of people that I work with allow me to do anesthesia in the safest way that I can for my patients, and that makes a big difference to me. in the hospital, sometimes you feel rushed because it's go, but in independent practice, it's just a different mindset, and I like that mindset.
Right. And so then talk to me about Zenfusions. Was that a new name to your company back in 2017, or is that something more recent?
So that's more recent. So I created KT Anesthesia just as the anesthesia branch where I was an
Gotcha.
independent doctor. And then in 2022, I had a conversation with a mental health nurse practitioner about her patients. And she was offering them ketamine lozenges for
Hmm.
their mental health disorders. And so I texted her and I said, why are you doing that? Why don't you just start an IV on these patients? Because the bioavailability for IV is greater than if you're taking it by mouth.
Okay.
And she said that she didn't know a CRNA or an anesthesiologist that could provide that service for her.
Hmm.
And so the bells went off in my head, and I was like, I'm a CRNA. I know what ketamine is. I do anesthesia every day. This
Yeah.
is a service that I can provide. And so that's where the ball started rolling and the ideas started coming in. And then 2023, in the spring of 23, we actually kicked off.
Okay, great. And the Zenfusions or the ketamine therapy, you saw that as an opportunity somewhere, a blue ocean, if you will, that's just somebody CRNAs are not doing or not filling that role. That's something that I can fill. And you'd always been in chronic care. Is that correct?
Since 2017, I've been doing chronic pain management,
Yeah.
and I saw patients where they were coming in with chronic pain, and part of their diagnoses were anxiety, depression, and PTSD.
Hmm.
And the more I thought about it, like those things go together. And
Yeah.
so I can help patients in the chronic pain management field as well as with their anxiety and depression. I can do so much more.
And has the Zenfusions, it is only doing ketamine therapy. So the type of CRNA work you're doing 2017, 2018, you are no longer doing those more general. It's all just ketamine therapy at this point. Is that
No, I'm still doing both.
still doing both? Okay. Okay. And the ketamine therapy, I don't know enough. How does that work? So I know enough to be dangerous in terms of, I know maybe in the, well, again, I'm making this up, my own knowledge. The mid 2000s, perhaps, that became, hey, we could use this to treat for depression, PTSD. And then there were lots of studies about trying it with through your nose or different ways to do it. And now it's almost an accepted type of practice for these illnesses. Can you explain how it works and what makes it so unique?
So ketamine therapy is used for patients that have treatment-resistant depression. So if you've been on the traditional antidepressants for years and none of that has worked for you, or your PTSD, anxiety, and your chronic pain, if none of those modalities that you've used in the past, you can use ketamine therapy in addition to your psychotherapy. So you have to use it together in conjunction. You can't just do one by itself.
Okay.
What they think happens is that it goes into your system and it changes the brain receptors called neuroplasticity.
Hmm.
It opens up your brain and it to change those receptors so that you're more open to experience those traumas that you may have suppressed with your PTSD or those symptoms of anxiety or depression that you've experienced. So you come in for your therapy, your brain is more open and susceptible to those changes and those feelings that you've had. And you go to your therapist, discuss those things that you felt, you might have seen during therapy, and together that helps you with your symptoms.
Okay. And I'm sure it's fact dependent, but is this something that you take over a series of time? Are your dosages higher at the beginning and then it titrates down as one perhaps gets better? How does that work?
So ketamine given in the operating room is given at a higher dose, but
Hmm.
during ketamine therapy for these modalities, we give it at a much lower dose. And for mental illnesses, it's 6 loading doses, so 6 infusions over a 2 or 3 week period.
Okay.
And you come in for those infusions. And then after that, you would come in periodically for a booster infusion. So it would
Okay.
depend on the patient and how often they feel those symptoms coming back.
Okay. And how, in your experience, have you been able to realize and see the results of it? Or is it so much that you're the technician, the CRNA actually applying the ketamine? You're not the psychiatrist, if you will, that's perhaps
Right.
dealing with that end result. But I'm just curious, are you able to get the full fulfillment of the work that you do?
I am. It's so much more different than just doing anesthesia for patients in the operating room. You go to the pre-op, you see the patient, you talk to them, you get a small rapport with them, and then you put them to sleep, and then you take them to recovery. But I never get to see them after that to see if they had a good experience, if things went okay. But with ketamine therapy, I see the patient transition from coming in anxious or depressed or with trauma in the beginning. And then slowly I see them start to smile again and
Mm,
open up and talk. And then when they come in and speak about, they can go to their kids' games now, they
mm.
can participate in their daily activities. Whereas when they first came in, they weren't able to do that. And that really
Yeah.
makes me feel good.
Yeah, that's great. Does Another wonderful question, does insurance cover ketamine therapy?
Some insurance companies will reimburse patients
Hmm.
for ketamine therapy. So some companies give them a super bill, and then the patient can present that to their insurance companies and be reimbursed.
Hmm.
But across the board, ketamine is not covered by insurance
Okay.
companies.
Okay. And so what does how many clients do you have per day? Or ultimately I'm trying to think, okay, what's a typical week look like for her now that you've got this established, you've been doing this for a while, and are you trying to grow it? What would it look like 5 years from now?
I definitely want to grow.
Okay.
So in the evening, patients will come in and we will have two patients at once. So I can do two infusions. Those like 40, 45 minutes. The patient recovers. So just say one patient is there for about an hour, 15 minutes. And then the next set of patients will come in, we'll do their therapy, we'll let them recover. So in the evening, we're doing about four patients in the afternoon, and then we'll do
Okay.
four patients in the morning.
Okay. Okay. And I know you've got a attending the doctor there, but also, is it just you in Zenfusions? Do you have employees? Do you have other CRNAs?
I have a medical assistant there
Mhm.
with me.
Uh-huh. Great.
The hope is to grow to where I would have more CRNAs available so that we can run multiple rooms at different clinics.
And how do you think, so what would be your plan to get to that growth? What are some of the things that you're working on perhaps to achieve that?
Right now, I think the key is education in the community with
Mhm.
healthcare providers and with laypersons. I think
Mhm.
doing more podcasts like this. And then on a weekly basis, I go out into the community where I'm visiting doctors' offices, nurse practitioner offices, all healthcare practitioners. I'm going to healthcare summits where laypersons are there. And so I'm just trying to get out and educate people about ketamine, that it is not a party drug. It
Yeah.
it could be used in this instance, and that it can change people's
Yeah.
lives. And so that's what I really want people to understand.
Yeah. And I think, as I mentioned at the beginning, even from my third person view, I feel like there was a stigma to it. And yeah, perhaps a party drug, that sort of thing. But I definitely feel like it, even from what little I know, that it's much more accepted this day and age. I'm sure you're seeing that as well.
I am seeing that as well. It's a lot more acceptable now than it was even 5 years ago or even a couple of years ago. So
Yeah.
I think more healthcare providers like myself get out there and we talk to people, we educate people and let them know that this is a great resource for them. It doesn't help everybody, but it is another tool that they can use to help with their mental illnesses and also with their chronic pain.
Yeah. And how many other clinics offer ketamine therapy? Is it?
There's several clinics throughout the DFW area that
Mhm.
offer therapy, but and then you can also receive ketamine by lozenges at
Okay.
home. It was approved during the COVID era.
Okay.
FDA decided that patients could do that. But the one caveat with that is that you're not monitored when you do that at home. So I caution patients to make sure that they go to a healthcare provider that's trained to use ketamine. They have standard of the art medical equipment where they're monitored and it's in a safe environment.
Hmm. And tell me about the heart behind the company, the name. So Zen Fusions, how did that come about?
So I think of when patients come in, their mind is chaotic, they're like all over the place.
Yeah.
And then I want them to come into Zen Fusions, have their infusion, and then when they leave, I want them to be in a Zen place, in a place where their mind is settled, they are calmer, and they feel great about themselves. And so I put Zen with an infusion together and created Zen Fusions.
Yeah, that's great. I love it.
Yeah.
What have you learned perhaps over the last few years, 3 years or so, doing ketamine therapy, perhaps how much has it changed in the 3 years since you started focusing on it? And what do you think is coming around the corner for ketamine therapy?
I think the big thing is that insurance companies will eventually get on board. I think the FDA is looking at ketamine as another tool for patients, and
Hmm.
they need to make it more acceptable for patients to use. So
Yeah.
they're going to so hopefully the FDA will talk to the insurance companies and they will be saying, okay, this is what patients, this is another tool they need. So we need to approve this so patients can use their insurance for it. I think that's the big thing that's coming around the corner for
Yes.
patients.
And after you get a treatment, can you drive? Do you have to have someone? How does the actual post op, if you will, occur?
Yes, so when you come in, it's just like you're going to have an outpatient procedure. So
Hmm.
you bring a driver and you come in for your infusion, and then your driver takes you home. And so
Okay.
you can't drive for 24 hours, make any important decisions
Okay. Makes
because
sense.
ketamine is an anesthetic. So you're still having an
Right.
anesthetic.
That's really neat. That's really neat. Are there other drugs out there that are competitors with ketamine in your line of work?
I don't think so right now. I think ketamine is out there by itself
Hmm.
simply because it can help with so many different things with PTSD, your anxiety, depression, and also with chronic pain because it can help with so many different receptors. So I think it's on an island by itself right now.
Yeah, that's great. That's really neat. So, as you think about this bigger business, perhaps more team, more help, more locations, from the business standpoint, how do you think you would address those? Is it something that you become all of a sudden that you would no longer be the technician per se, you would be the manager or the CEO? Is that something that Tangy Kincaid has always wanted to do? Do you have an entrepreneurial spirit in you that underneath the surface?
Surprisingly, no, I've never
Okay.
do that. I've always wanted to just do my own little thing and just go to work and do my thing by myself. But the more and more that I've done it and the more people that I talk to, it's really a passion now that I want to do this and more.
That's
And
great.
I get calls all the time from nurse practitioners that want to be in my office and work with my patients. And I'm not to that point yet, but
Yeah,
I will be able to hire them in the near future so that so that we can do the ketamine therapy part and then they can do the psychotherapy together in the office with patients. So
right.
that's ultimately the goal.
Yeah. Yes, that's a great point. So, what would you tell a nurse who reached out to you and CRNA and wants to head down this same path that you had? What pieces of advice would you give them knowing what you know today?
You need a good business plan.
Okay.
You need a great accountant and you need a great attorney. You need those people on your team to help steer you in those different directions so that, because you're going to make mistakes and that's perfectly okay. But if you have a good team behind you and a good support group, that's the key when you start out on your entrepreneurial journey.
Hmm. Hmm. Very great. And have things gone awry from your business plan as most do?
Yes, the hardest part has been referrals
Interesting.
from the different healthcare providers. They're reluctant, just like laypersons are,
Okay.
to patients for ketamine because in their mind, they still see ketamine
Yeah,
having the stigma. So that's why I want to get out more and educate as much as I can.
that's interesting. That's interesting. You had sent a kind of along the lines of the business plan, a financial question. This is a podcast about financial planning, and I try to weave these in and out. If you notice, I'm asking questions about your accounting, et cetera. And the question that you had asked and sent us to in advance was actually a really good one we talk about a lot in my world. Actually, I was writing about it today for a podcast that's going to come out in a couple months. And your question was, during retirement, is spending 4% of your income still the rule of thumb? So that's a very good question. I'm going to answer that. And as you can imagine, the answer is it depends. But I'm curious, what made you think of that question? Had you read about it? I'd be interested to know where from your side. That'd be helpful.
When I graduated from anesthesia school, I realized that I was making a lot more money than I had ever made in my entire life.
Yeah, yeah.
And I really didn't, I knew basic information about financial planning, but I didn't know all of the information that I needed. So I
Mhm.
just started reading as many books as I can
Oh, good for
and
you.
listening to podcasts and just trying to educate myself so that I can know exactly where my money is going, how to grow it, and how to be successful in retirement. And so
Yeah.
that was a question that was always there, the 4%, the 4%, the 4%.
Mhm.
And so I just wanted to know, is that still the
Right. Yeah. Well, that's a really good question. As I said, it really depends. I think the 4% rule I'll back up for people who are listening. The 4% rule means there's some studies done in the 80s. Essentially, if you can take out 4% of your retirement savings, if you will, every year, and you can adjust that for inflation every year, and you could realistically never run out of money if you take out 4%. So if you have $100,000, or let's round up, if you have $1 million in your retirement account, you could take out $40,000 a year, and your $1 million should always be intact. The question or the what, and I think it's a great benchmark for people to strive for, especially as you're in the accumulation phase, just to give you some line in the sand. Just to use some quick math, if you know what you're spending today, if you're saying I live a $80,000 a year lifestyle, well, then I know I need to have at least 2 million to maintain that lifestyle. So it's a good benchmark to use while you're saving. Where it gets much more personal, however, is probably when you're within 5 years from retirement.
Mhm.
Because just like your business plan, just like life, nothing is linear, nothing is that clean and neat. Things change. So the closer you get to retirement, that rule of thumb actually is less meaningful, because then you have to first answer the question, okay, Tangy, you'd like to retire. What do you want to do in retirement? What does that look like to you? Again, because everybody is different. Then what you want to do is try to calculate, okay, I know how much I spend and I want to probably maintain that lifestyle, but do I have bucket list items? Healthcare, what's going to happen with healthcare? Long-term care, perhaps? Or do I want to save for education for my grandchildren, perhaps? So there's all these different facets that we have to try to figure out and literally put on a timeline of when that happens and what that cost would be. And again, we don't know how long you're going to live. So we want to assume that you're going to live a very long time so you don't run out of money. If you do that, if you say, okay, I know that I need $10,000 a month for the rest of my life, or that's $120,000 a year. Well, once you've established that number, then what you can do is you can say, okay, how am I going to pay for it? And there's three ways that you can pay for it. The first is social capital. And what that means is something that's coming to you in a fixed way. So the first thing is Social Security. So Social Security, which I do believe will be there, so don't worry about that. But again, that was never meant to be all of your retirement. Is meant to be perhaps a quarter of it. The average couple, the Social Security Administration spends about $50,000 a year in Social Security. So if you if you have $100,000 life or $120,000 lifestyle, 50,000 is going to come from Social Security. Okay, so then I have $70,000 difference each year that we have to pay for. So then from social capital comes working capital. Now you may not retire is a terrible word. It sounds so final. You may continue to do part-time work, or you may do other things. So we can add that to it. But if we don't have any working capital, then it becomes just the financial capital, and that's the third bucket. And that's when we think of 401ks, 403bs, savings, Roth IRAs, whatever it might be. How much is in those accounts, and how much will those accounts grow every year? And will that be able to suffice to cover that $70,000 a year difference that Social Security didn't cover? Does that make sense?
It does, yes. Okay.
And again, that's very topical from 30,000 feet. Then there goes even much deeper. Tangy, you could be much more risk tolerant than I might be. So you could say, Brett, I'm okay with some risk. So we might be able to pull 5% or 6% a year out of your retirement, where somebody who's more retired might only want to do 4. It becomes very fact dependent the closer you get to retirement, but I think the 4% rule is a very good benchmark to use for retirement. Absolutely. So that's a great question.
Okay, great. That makes perfect sense.
Um, Has your business grown to a point where one of the beautiful things about what I love about CRNAs and business for themselves is because you've raised your hand to society and said, nobody's going to pay me, I'm going to work and get paid for what I do in my own business. The benefits of that, there's some tax planning benefits, but there's also things like retirement savings that you can save in ways that a W-2 employee cannot. That could be advantageous. Have you found, Tangy, I'm just curious, in your business, have you been able to, through perhaps a SEP IRA or a solo 401k, anything in those lines for your business yet?
I do. Actually, I have a SEP IRA.
That's awesome. That's great. And so for some of you thinking about becoming, one of the advantages of being independent, a SEP IRA is, in theory, you could save up to perhaps 25% of your net income into a SEP IRA, which is all tax deductible for you and tax deferred. So that could be a very large number, if 25% of your net income. So that's really great. So good for you.
Thanks.
Good for you. Tangy, as we wrap up this podcast is about success for people in the CRNA community, business owners like yourself, CRNA practitioners. But as we both know, that success can mean different things to different people, just like most things in life. So I'm curious, what would your definition of success mean for you as you look towards the future?
For me, being able to help as many people as I can and retire when I get ready and be at peace with all the things that I've done in my past life.
Oh, I love it. I love it. Thank you for sharing that.
Yes.
Is there something you're excited about in the next year or two for Zenfusions that you'd like to share?
So I am getting ready to do a ketamine awareness forum on the digital platform called Mental Happy. And it's just an educational forum where I talk about ketamine therapy, what it is, the different treatment modalities that it can help. Just trying to, once again, just another avenue to try to educate people.
That's great.
Exactly.
And we'll be sure to have all the links to your resources, Tangy, in the show notes below. If anybody's interested in looking at Tangy's Zenfusion website or wants to get in touch with Tangy, we'll have that all for you there. And as well as some information that we talked about today about ketamine therapy. Yeah, and mental health, I definitely think is a priority. Also, I'll ask one last question. Mental health being such a major part of our world today, what do you think, Tangy, we could do to support one another in our well-being, specifically within, let's say, the CRNA community?
I think we need to not put as much pressure on each other as we do. I think we tend to burn ourselves out because we feel like we have to be perfect and we have to do it in a certain way, but there's no wrong or right way to do it. It's just your way and you can do it the best way you can, and there's no pressure behind that.
Yeah, love it. Great. Thank you for that. That's a great answer.
Thank you.
Thank you, Tangy Kincaid, for being on this episode of MoneyRx for CRNAs.
Thank you, Brady. It was a pleasure.
Thank you. We'd love to have you back.
Thank you. I'll do that again.
This podcast is for informational and entertainment purposes only. It should not be relied upon as a basis for investment decisions. This podcast does not engage in rendering legal, financial, or other professional services.